The holidays will be here before we know it, and we all want to look our best.
Well, Dr. Kerry Shaffron with Riva Aesthetic Dermatology has a way to help. He's here to tell us about CoolSculpting. Hello, sir. How you doing?
I'm doing well.
Yes.
How about yourself?
I'm doing well. Thank you very much, sir.
Fantastic.
Dr. Good morning to you. You're here to tell us all about CoolSculpting. First off, explain what it is.
Well, CoolSculpting is something that we might have heard about before. There's some new innovations, so I thought I would bring by some new technology to show you what's happening.
Okay, very good.
In the CoolSculpting world.
It is a procedure that freezes fat. So if you have any pinchable, unwanted fat somewhere on your body, you can CoolSculpt it away.
Exactly.
Okay.
That's exactly what it does, without surgery, without downtime, with essentially no risk.
Okay.
Exactly.
So how does it actually work, Doc?
So we have an applicator, which this handpiece, which simply fits on the area you're trying to melt away.
Right now we're looking at some video of you getting the procedure done in your office at Riva.
Yes. Just to show you that even a scaredy cat like me can do it. It's so easy. I did this between my morning and afternoon patients, and this is about 6 weeks ago. I love the difference I can see already, which maybe in the future I'll show you a picture of that. My little love handle is what we did. So I had this kind of handpiece right here. It simply goes on the skin. It stays there for about 35 minutes, and it freezes the fat underneath it, which starts that fat into a dying cycle, a death cycle, and it just melts away.
And just 35 minutes is all that it takes.
Yeah, that's it. 35 minutes. Now, you may have to do more than one, depending on how many areas you're trying to melt away, but exactly, that's how you do it.
Is this the same applicator you would use elsewhere on the body? I know you've mentioned before that you can treat the back of someone's arms, the bra rolls or the bra fat that some women might have. Is this the same applicator you would use?
It's almost the same.
Okay.
We have several that are different shapes, different lengths, and specifically designed to customize for the particular body site that we're treating. So that's how it is. This is the new one, by the way. This is the one that actually is the 35-minute instead of the 60-minute. This came out very recently. This actually makes for a more comfortable, faster treatment with still no change in downtime.
All right. Now, what is this video that we're seeing right now? What is that handpiece?
This is the new hand. So this is the Zimmer Z-Wave Pro. This is a fantastic little device here, which improves by at least 20% the results. You can see on the screen there that we're actually treating the area that we've just finished CoolSculpting with this. This produces these sort of acoustic shock waves that penetrate into the skin and break up that frozen fat better than the manual massage alone, which is the standard protocol. Right.
So after you receive a CoolSculpting treatment, you use this, and that accelerates the results.
Exactly. Exactly. So we use this. This is a handy little device. This comes from Germany, actually. It produces about 2,500 pulses into the skin. You can see the difference here on the screen. The right side was treated with this device. The left side was not.
Wow.
Both sides CoolSculpted, but the right side, then we went back and did this. Now, this wasn't my patient, but did this particular device on the right, and you can see what a difference.
Oh, wow.
So
yes.
this is something that I feel very, very strongly in. It doesn't cost any extra. It's in our office. Most offices don't even know about it.
Right.
But this is something I feel strongly about that, could really enhance the results. And it doesn't have any additional downtime or other side effects.
Okay, that would be my next question. Is it more additional downtime, or is it less downtime because we see different results?
Well, the amazing thing is the results are improved, but there's no difference in the downtime. Now, the one thing is, it's a little sensitive when we're putting it on that area where we just peeled off this guy. So it's a little touchy, but it only lasts a minute or two. And for those results, you can't beat it. And now we do this for all of our CoolSculpting patients, except when we're doing this little fat pad here where we really don't need it up there.
Talk about that, too. This is an area that you can treat as well, the chin.
Yeah. Oh, absolutely. Absolutely. That's the newest handpiece that came out. We call that the Cool Mini. It's a cute little thing. It's about yay big, and it just snugs right up under there. And that's about a 45-minute treatment for that particular one. And that's a fabulous way of, again, without surgery or downtime, melting away that little unwanted roll under there that some of us have, sort of genetically.
I know we got some more before and after pictures that we want to go ahead and get to, too.
Yes, people want to know what are the results going to be with CoolSculpting, and here's a look.
And so these are little shots. These are patients of ours. So instead of the company's stock photos, these are people that live in our area here in the Carolinas. And real life examples of before and after pictures of people that had these great results, again, without surgery. Right there. It's a remarkable kind of black magic technology.
Right.
We could talk about that around Halloween, right?
Yes, you can.
Black magic thing.
Let me ask you this, Dr. Shaffron. Why should someone go to Riva and not somewhere else? The truth is that, some other people offer CoolSculpting. Why go to Riva and not to another office?
CoolSculpting is becoming more widely available, absolutely. I feel like we do the best job. First of all, we got this, and most people do not have this Z-Wave Pro. It's quite an expensive device. Most offices aren't willing to pay for this. for use on their patients. So we have this, and we don't charge extra for it. It's simply part of the service. And also, we're a medical office. We're not a med-spa, so there's a physician there all the time when you're getting treated. There's really never a problem with this, but if you had anything else you might want to do, Botox or fillers, or if you want to get your body checked while you're there for your skin cancer screen, we can do all that at the same time.
My last visit to the office, this is a true story. I had CoolSculpting, I had Botox, and I had a skin check, all at Riva Aesthetic Dermatology. Yes, he's my doctor now.
Right on, Doc.
Because I met him here. It's true.
So it kind of worked out that way.
Yeah.
Yeah, and so did it go okay? Were you happy with
Oh, it's wonderful. I could hang out there all day. I wish I could come see you every week. I would do it all every week, as much as I could, as often as I could.
It's fairly easy, isn't it? I mean, it really is.
Oh, it really is easy. And that little Z-Wave thing, that didn't bother me at all.
That's right. I forgot you had that.
I had that too.
You had that. I forgot.
Honey, I had the works done at your office.
All right.